Tyler. Coming up on today's show, it may look like a submarine, but no. It is a hyperbaric chamber. I can't even believe this thing. It's used at Hartford Hospital.
No, I've never heard of it. I'm so excited to see what this is all about.
No, it's really cool. They use the state-of-the-art chamber to treat a variety of medical issues, including slow healing wounds. A lot of people with diabetes. This is and it's cool to just be in there.
Yeah.
So we're going to show you how the device works.
Okay, what are you wearing?
This is my, I have to get suited up because I'm about to enter the hyperbaric chamber. This is what you wear.
To go in this?
Okay, first of all, I told Melissa about the hyperbaric chamber.
I was like, what is this?
She said, do you go on it on the Connecticut River?
Yeah, no, he said it's like a submarine. I said, oh, where, like for the Connecticut River or something?
I'm like, no, it's at Hartford Hospital. So this is what they put you in.
Yeah.
And it's really incredible. They have more than 5 million Americans suffer from, well, not here in Connecticut, but across the nation, from non-healing wounds. And if you're one of these people, you're in a great spot for treatment because at Hartford Hospital, they have a specialized center for wound healing and hyperbaric medicine. It includes a state-of-the-art hyperbaric chamber.
Wow.
And it's like a little submarine. We went and visited. Take a look at this. It may look like a submarine, but in fact, its purpose is much different.
Right, so this is a hyperbaric chamber, and hyperbaric oxygen is essentially the delivery of oxygen under pressure, and it treats a variety of medical disorders.
It's a very simple concept. It's just oxygen to a patient under pressure.
That's correct.
So it would be like kind of going undersea.
Absolutely, on oxygen, yes.
Okay, on oxygen.
It's like diving underwater.
Dr. Kelly Johnson-Arbor is the medical director of the Center for Hyperbaric Medicine at Hartford Hospital. The 10-person hyperbaric chamber she's referring to has been here at Hartford Hospital since 2004, and it's the only one of its kind at a medical center in New England.
What is it most commonly used for here at Hartford Hospital?
Here at Hartford Hospital, the most common reasons that we put people in this chamber are for non-healing diabetic foot wounds, for late effects of radiation injuries, so either people that have radiation area wounds that won't heal or have, for example, exposed bone in areas that had radiation to their face. We also do a lot of carbon monoxide poisoning treatment.
The best way to explain it, the pressure increases oxygen supply in your bloodstream, and that, in turn, helps you heal. You can see patients wear hoods in the chamber, and that's how the pressurized oxygen is delivered to them. The treatments last about 2 hours long, and patients receive them for 30 to 60 days, depending on their diagnosis and response to treatment.
You've seen the wounds go from horrible to better.
Correct.
I mean, you've seen it with your own eyes, so you know it's working.
We've had wounds that have healed. We've had wounds that have gotten smaller. We've had patients that had horrible pain and, horrible sores from radiation exposure for their cancer treatments that have actually gotten a lot better.
I decided to get suited up like a patient to see what it felt like.
So now that you have your shoe covers on and you would be in scrubs, we will put these hoods on you as well to deliver the oxygen. Each hood is personalized for each patient, so you can see that yours has your last name on it.
Haney.
Yeah, that's you, so that you don't get anybody else's germs or anything like that. And basically, the hood goes over your head like this. And then there would be a hose. Are you okay like that?
Yeah.
Okay. There would be a hose that would attach to one of these little ports right here, and that would go to the oxygen delivery system.
It might look claustrophobic under this mask, but I feel rather comfortable, I gotta be honest with you. Once inside the chamber, patients can do what they want. Sleep, watch TV, read. Doctors can even pass food to them through a transfer chamber. It's all closely monitored with medical assistants inside the chamber at all times. Lori from Colchester was one of the patients we saw receiving treatment. She's there for an ongoing wound on her foot.
Is it like a party in there?
No, it's very quiet in there.
Very quiet, and but there's nothing to be afraid of?
Nothing to be afraid of. They do ask you if you're claustrophobic. I wasn't, so I didn't have an issue with that.
The chamber is just one part of Hartford Hospital's wound center. Anne from Bloomfield recently fell and has been visiting the center to heal a huge wound on her leg. While Anne's wound doesn't require hyperbaric treatment, she needed to know how to prevent the infection and also to help it heal in the most effective way.
How are you doing today?
Very well, thank you.
Good. And how is your wound healing?
Very well.
Good, all right.
Very surprisingly well.
Okay. Do you have any pain at all?
Not much.
The specialists at the center work with your private physician to decrease both your cost and recovery time. Was grateful that she said her wound was so big, and we obviously didn't want to show the wounds because they're a little you know, not the most
Not good
pleasant
for
things to look
TV,
at, but
right.
she was like, my wound went from this big to this big. So
Amazing.
it's just unbelievable.
I've never heard of it. I'm so glad to know about that.
Actually, you might be familiar with the term hyperbaric chamber from Michael Jackson, because he used to go into my hyperbaric
Really?
chamber to think that it was. Now, hyperbaric chambers are used for other purposes, like they're even on the roadsides in some states in like weird circumstances. Those are, you know, those are not the ones that are covered by insurance.
Right.
This is for use in a medicinal purpose, used to treat about 13 different conditions at Hartford Hospital. So check it out. And that doctor, I love her. I think she's one of the most wonderful people. So thank you for watching. We will be back in 2 minutes with a quick short break.